Thank you. Secretary, thank you for the time yesterday, by the way. And if I may, to the surprise of probably everyone here, I want to really, really commend you on pesticide work. The sugar work is absolutely right on the mark. The processed food work will save lives, for sure, and save costs. And so to those points, thank you very much. I also think where some of our governors have asked questions about savings, this part of this $4 trillion system, it absolutely will save a lot of resources. And we governors then will lean on you to reinvest it in good programs. My question for you, humbly, is, so right now, a lot of the core public health infrastructure is in peril. I mean, there's pretty deep cuts, and I know that that's not all you. I get it. You have the president's ear, Oz does with you. So we're seeing these big cuts, and we are worried about health disparities in our states. You know, that is a very real problem for all of us. What I'm worried about is the cuts could threaten, rural health care. And it's very real for all of our states, particularly middle America. And so I want to know what your feeling is. Like, how are we going to be able to change diets if we lose our capacity to have nutritionists? How are we going to be able to change the trajectory of processed foods if we are cutting SNAP and not given the flexibility to make those changes? And again, I commend the work on sugar. We will do that in our state too. How are we going to do these things if in healthcare, and I'm a healthcare provider, as you know, if the lowest hanging fruit falls away, like mental health care, because those are the disciplines that will get cut if there's less resource available to us in our states. So just humbly, if we're going to do these things, which are very well thought out, how are we, if we have fewer pediatricians, going to give that advice, which you correctly say is essential? So how can you support us with all of your plans if we're going to suffer these cuts?
And thank you very much. I really enjoyed our conversation yesterday. I'd start by saying this, that, and I told you this yesterday, I'm the Secretary of HHS. If it were up to me, I wouldn't cut anything in my department. There's no cabinet secretary, with the exception of maybe one, is Linda McMahon. There's nobody else, I think, in the cabinet who wants to see any of their budgets cut. We also support the president because, I understand, and I ran for 2.5 years for president, and Americans are concerned about the budget deficit. We have a $34 trillion debt now. Within 5 years, 50% out of every dollar we collect in taxes is going to go to servicing the debt. In 10 years, that's 100%. And we're leaving this debt to our children, which is going to diminish their capacity to get health care and good food and all these other services. National debt is a social determinant of health. And I admire the president because it's not popular for any politician to stop spending money that's not his. And he is doing things that are very, very difficult and very controversial, and looking down the road and doing something that all of us know has to be done, but none of us knows how to do it. But having said that, he is particularly concerned about rural health, and I ran on that issue, and it's probably the issue that I talked to more senators about, Democrat and Republican, when I was going through my confirmation process. And one of the answers to that, and I think it's a really good one, is this provision for rural health transformation provision in the big, beautiful bill. And Dr. Oz is going to be here, I think, today, talking about that. And it's a $50 billion payment now, and it's going to improve rural health. This is a lot of money. It's $10 billion a year for 5 years. To put that in perspective, we spend about 6 to 7% of our Medicaid budget on rural hospitals. So that's about $20 billion a year. So this is $10 billion a year that is going to go to rural health. So it's not trivial. It's going to raise the revenues of rural healthcare providers by 30% over the next 5 years. Dr. Oz will talk about the details of that, but every state will get money for it. Some will get more, some will get less, depending on the quality of your application and your arguments. The money has to be spent by the end of this year, so it is on a very, very fast track. The applications have to be in by September, and it's going to go for infrastructure improvements, for workforce improvements, for innovation, or all of these things that are holding rural hospitals back. And so it's a big investment, and it's an emblem of my personal and our commitment, the president's commitment to rural health.
And I appreciate that, because that's why I proposed it to him, okay?
Well, thank you.
But it is going to help us incredibly. The question is, after the 5 years, and that is going to save us to a large degree, but after 5 years, we're going to have to continue to reassess, because those monies could likely go away, and the governors will worry about Medicaid. But I really do appreciate that. And the last thing, forgive me for asking a second question, is you were saying about the future. Well, we just ballooned the deficit with the tax break. And so we're going to have to have kind of an existential moment sooner or later, because if we did add this deficit while we made some theoretical long-term cuts to our healthcare safety net, we're probably going to need you and others to influence the president to either lower that debt or find a new mechanism to help our country.
I mean, I deal with Roosevelt every day, and he's not, he's looking at more cuts, and cuts that are not going to necessarily be popular within my agency and other agencies. So it's a battle that we all have to continue fighting.